scientific session. The first session for today, we have among with us our esteemed chairperson, Dr. S. Sundarapandian, sir, Professor and Head, Department of Anatomy from SRM Medical College, Chennai. Sir has completed his MBBS from Tanjavur Medical College and MS Anatomy from same Tanjavur Medical College. Sir has got an teaching experience of 28 years. Sir's professional achievements and awards include Global Faculty Award in 2020 from AKS Education. Sir has received Best Performance Award from SRM University. Sir has received Dr. M.M. Cooper Best Paper Award on the paper Congenital Diaphragmatic Hernia. Sir has also received M.M. Cooper Best Paper Award by presenting the topic Dilated Coronary Sinus with Persistent Left Superior Vena Cava in the year 2006. Sir's field of interest includes microanatomy, embryology, and genetics. Sir has published nearly 50 journals, both in reputed national and international journal. We welcome you for the first scientific session, sir.
Thank you, sir.
Welcome, sir. We also have with us our second chairperson, Dr. Manisha Sandeep Takate, Professor and Head, Department of Anatomy from D.Y. Patil Medical College, Navi, Mumbai. Madam has got her qualification MBBS from Pune University in 1993. Madam has also received DLO from Pune University in 1996. Madam has completed her MS Anatomy in 2000 from same Pune University, Maharashtra. Madam's experience includes she has worked as medical officer in the Department of Surgery and for 6 years in Fiji Island. Madam's professional achievement and awards includes she has been a recognized PG guide since 2017 and 2 PhD scholars have registered under her guidance. Madam has published more than 15 articles in both national and international reputed journals. Madam has got an experience in conducting hands-on fetal dissection workshop on GI tract development and congenital anomalies in the International Summit, MediSpine, in 2019, organized by D.Y. Patil Medical College, Navi, Mumbai. We welcome you, ma'am. I request the chairperson to introduce our speaker today. Over to you, sir.
Good morning, sir.
Good morning, sir.
Good morning, ma'am. Deepti, ma'am. Am I
Good
audible,
morning,
sir?
sir.
You're
You're audible.
Yes. Very good morning to one and all gathered here. I am very happy to introduce Dr. Deepti Shastri. Actually, madam, I don't think madam needs introduction. Madam is a popular personality. So, madam has completed, presently working as Deputy Dean in Vinayaka Mission, Kirupananda Variyar Medical College Hospital, Salem. Madam has completed her MBBS at 1990, MS Anatomy in 1993. Madam is working now as professor also at Vinayaka Mission. So, madam is having around 30 years of experience in anatomy. Madam served in various positions in various associations. Recently, madam was the president for the Association of Anatomists and conducted the conference, National Conference of Association of Anatomists. Madam is the membership in various prestigious associations, life member in Association of Anatomists Tamil Nadu Pondicherry, life member of Anatomical Society of India, life member of Indian Medical Association, Fellowship International Medical Science, then founder member of Academy of Dental Education, member and National Academy of Medical Sciences. Like that, madam is having association with so many associations. Madam has published around 50 scientific papers. Then madam is having vast experience in conducting conferences and CMEs. So during COVID, madam has organized so many CMEs and conferences. I attended all the conferences, ma'am. So one coincidence, my year of birth, year of completion of MBBS, year of completion of MSc, all are same. I am happy to share with you, ma'am. So over to ma'am. Hello, ma'am.
Yes, sir. I'm sorry, I got disconnected for a while. Can I share my slides, sir?
Yes, ma'am. Yes, ma'am. You can share.
Are my slides visible, sir?
Yes, ma'am.
Your slides are visible.
Good morning, everyone. Thank you, Sundar Pandian, sir, for that wonderful introduction you gave me. And I would like to thank AVMC Organizing Committee for inviting me as a speaker for today's session. Well, for those of us who were entertained by these 6 on the slide through their sitcom, that is Friends, right through 1994 to 2004, Joey Tribbiani and his defining phrase, "How you doing?" would not be lost. Well, how often do we greet a complete stranger, or for that matter, a colleague that we meet every day by a simple quote, "How are you doing?" Well, is that important? To dig deeper into a seemingly innocuous greeting, which most of us in the midst of our frenetic schedules choose to ignore, and that which could be a defining moment in the chaotic lives of the people that we meet, let us explore it through this session on fostering emotional intelligence, a 21st century skill in medical education. Well, I'm Dr. Deepti Shastri, the Deputy Dean and Professor of Anatomy, Vinayaka Mission's Kirupananda Variyar Medical College and Hospital, Salem, Tamil Nadu. Our cerebral cortexes and the IQs have always assumed importance in medical education, be it in the admission process or promotion to the next phase of education. What then is the role of the limbic system? Should our emotions override our thoughts? Well, EQ, or emotional quotient, the other name for emotional intelligence, most certainly is set to overpower our IQs. The objectives of my session are, by the end of this session, you will be able to define emotional intelligence in terms of medical education, discuss research evidence on influence of emotional intelligence on medical education, identify the emotional intelligence competencies, justify the role of mindfulness in enhancing emotional intelligence, and champion the cause of fostering emotional intelligence in your students. Well, let's start at the very beginning. The term emotional intelligence was created by 2 researchers, Peter Salovey and John Mayer, in their article titled Emotional Intelligence, published in the journal Imagination, Cognition, and Personality. And this was as late as the year 1990. How do we define emotional intelligence? There are several definitions to emotional intelligence. They all mean the same, but we need to acknowledge the one by Dr. Daniel Goleman, who is a psychologist and a writer, and who has been credited with popularizing the term emotional intelligence in 1995 in his bestseller, Emotional Intelligence, and later through his other book called as Working with Emotional Intelligence. Dr. Goleman described emotional intelligence as a person's ability to manage his feelings so that these feelings are expressed appropriately and effectively. According to Goleman, emotional intelligence is the single ladder of success in the workplace. Stephen Stein and Howard Book, in their book, The EQ Edge, have defined emotional intelligence as a set of emotional and social skills that influence the way we perceive and express ourselves, develop and maintain social relationships, cope with challenges, and use emotional information in meaningful and effective ways. Alicia Monroe and Elisa English, in their article titled Fostering Emotional Intelligence in Medical Training, the SELECT program, in their effort to emphasize the importance of physicians' emotional intelligence, have said that emotional intelligence of a physician is how they manage themselves, their emotions and behavior, and their relationships can have significant influence on team-based care. Physicians' emotional intelligence can support empathy and improve communication between team members. It can promote shared decision-making amongst medical professionals, help in conflict management, and it improves transitions between healthcare settings, be it hospital, nursing home, community, or even the death of an individual. Now, although the study of medicine and the tradition of the medical students gaining clinical experience in hospital wards has not changed significantly over the years, the experience of the physicians practicing in the current times, I'm sure all of you will agree, has changed drastically. Physicians who were once deified are confronted with increasing regulations, which of course are aimed at quality healthcare, but also may be inconvenient to physicians at times. And they're also faced with conflicts with patients and their relatives. A number of doctors are seen to experience professional burnout. And there's also threat to their mental health and their work-life balance. So in this scenario, as the next generation or generation alpha of physicians enters into the healthcare environment that is existent today, they need to adapt to the new practices as well as regulations. Emotional intelligence and mindfulness provide a possible solution to the struggles that these physicians are invariably going to face. Now, look at this phrase, to empathize or not to empathize. That's not the right question. I hope Shakespeare does not roll in his grave. In the past, emotional distance from patients was advocated in order to maintain a degree of objectivity. But in current times, an empathetic approach is advised. And the relationship between patients and doctors is moving towards more of a partnership. And this is bound to foster good communication skills in order to improve the patient satisfaction and to build mutual understanding. The results of a study by Debbie Johnson show a direct correlation between medical education and emotional intelligence competence. It makes the field of medical education an ideal one in which to integrate further emotional intelligence training. Is emotional intelligence tangible? Well, if you have ever held yourself back when you have felt like lashing out at somebody, you're already familiar with one of the ways that emotional intelligence works. Can emotional intelligence be felt? Can it be touched? Can you see it? While, like other aspects of the self, it is not tangible. But even though we cannot see emotional intelligence or feel it, we can certainly feel its impact. Now let's move on to the competencies of emotional intelligence. These competencies have been identified by, once again, Daniel Goleman. I'll be referring to Dr. Daniel Goleman several times in the course of my session, and that's because he has done pioneering work on emotional intelligence. Well, according to Daniel Goleman, emotional intelligence has 4 competencies: self-awareness, self-management, social awareness, and relationship management. Now let's look a little bit more in depth into each of these competencies. Self-awareness means knowing your own emotions. Self-awareness is about recognizing and understanding your emotions, what you're feeling and why you're feeling, as well as knowing how your emotions affect the people around you. How will your emotions affect your professional life? Well, self-awareness is the basis of good intuition and decision-making. It helps you to instinctively make the right choices for you in all aspects of life. Self-awareness is also knowing about your own strengths and weaknesses and what is important to you in terms of your values and moral compass. Next, we move on to self-management. It's also called as self-regulation. It's about managing your own emotions and motivating yourself. So once you've mastered emotional awareness, the next step is managing yourself, your emotions, particularly the negative ones, more effectively. How do we go about it? It needs you to treat other people with respect and try to always stay in control. Now, if you have a tendency for emotional outbursts, in that case, you need to practice being calm. That is, you have to take a step back and take a deep breath. It's also important that you stay true to your own values. It also means that you set very high standards for yourself and work hard in order to achieve those goals. You need to stay optimistic and try to always look at the positive side, even in negative situations. Next, we move on to social awareness. It is about recognizing and understanding others' emotions. Now, social awareness is described as being a people's person. Those who are socially skilled are good at dealing with others. It involves empathy. That is the ability to put yourself in other person's shoes and being able to look at the situation from their perspective. Next, we move on to relationship management. This is about managing relationships and others' emotions. It also means you need to manage change and resolve conflicts effectively. Where needed, you need to give praise to your colleagues if it is due. It is also about awareness of others' feelings and responding to others' feelings positively, even if you do not agree with them at times. Dr. Daniel Goleman in his book, Emotional Intelligence, why it can matter more than IQ, advocates the emotional competence framework of personal competence for self-awareness and self-management, and social competence for social awareness and relationship management. Now, for the most important question, can emotional intelligence be taught? What do you, the participants, think about it? Do you think emotional intelligence can be taught? If you can post in the chat box, or you can unmute yourself and respond. Just a couple of you, if you can post in the chat box, if you feel emotional intelligence can be taught, you can just say Y for yes, N for no. Ma'am, Nakte ma'am, can you please read out the response?
Can be modified. It can be modified. As you said, you have to be optimistic, see the positive side of it. So it can be modified, I feel.
Okay, ma'am. Yeah, okay, ma'am says emotional intelligence can be modified. And if the moderators can read out any responses that have been posted. Okay, I'll go on then. It is believed that emotional intelligence is an ability-based skill, according to research work done by Zeder, Roberts, and Matthews in their article published in the year 2007, Can Emotional Intelligence Be Schooled? A Critical Review. They say emotional intelligence is an ability-based skill. And though it may be inherently present in an individual, it is an ability that can be taught, learned, and changed. It allows for training in specific competencies, the four competencies I mentioned earlier, and it is used to address the specific aspects of the doctor-patient relationship that are not working well. At times, self-awareness in a relationship may be working well, but the relationship management between the doctor and patient may not be working well. And teaching emotional intelligence should be a priority in the field of medical education in order to better facilitate this relationship in the future. Now, let us see what is the anatomy of emotional intelligence. Emotional intelligence represents the ability of higher brain centers. You can look at the picture on the left. The neocortex is the rational brain, that is the prefrontal cortex. So the ability of the prefrontal cortex in order to monitor and direct more primitive emotional signals from a phylogenetically older brain structure. You can look at the temporal lobe in the brain picture, the limbic system, which is considered to be the emotional brain. So the prefrontal cortex can monitor and direct the amygdala or the hippocampus part of a limbic system in such a way that they are used constructively by the individual rather than destructively. This comes out of the research work done by Humphrey in the year 2007. The work also indicates that those individuals with higher levels of emotional intelligence are able to identify emotional states, not just in themselves, but also others, using these higher cortical structures. Now let's see how we can foster emotional intelligence competencies in medical education. Where in the basic medical science curriculum are we targeting emotional intelligence competencies currently? Do you think we are targeting or addressing emotional intelligence competencies in medical education? That too, basic medical science education? Well, we are all familiar with the new elements which are being introduced in CDME. So we have adaptive learning, which basically addresses self-awareness. Reflective writing, which we expect our students to indulge in after every teaching learning activity, where they need to jot down what they felt during a teaching learning activity. So what that they feel it and what is next. So they are thinking their thought process and feelings and jotting down in their logbooks or in their portfolio. So this is where we are addressing self-awareness, early clinical exposure. This is where the students are going into the community or into the hospital setup, and they're not actually learning how to examine a patient or to diagnose a patient or give management. But they basically go and find out how different professionals, whether it's a nurse or a compounder or a ward boy, doctors, how they interact with each other. So they basically look at the relationship management. And of course, the AdCom module. There are many modules, and the specific teaching learning method that has been advocated is a hybrid approach, problem solving approach, which basically targets the IQ. So where is the IQ involved? We'll take, for example, one of the modules of the first phase, that is the cadaver as the first teacher. What specific competency are we relating it to? That is emotional intelligence competency. Again, self-awareness. The student is becoming aware of the importance of the cadaver, which later they will interpolate to other subjects as well as to the patients later in life. Here I would like to just relate to you that our university, that is Vinayaka Mission's Research Foundation, we have value-added programs for MBBS students. And for the second MBBS students, since the year 2020, we have this value-added program called as Teamwork and Team Building. And during the course of this particular value-added program, we ensure that the social awareness of the students and relationship management improves. And this academic year, we have begun a new value-added program called as Values-Based Life Skills and Self-Compassion. And this relates to self-awareness, self-management, social awareness, as well as relationship management. And this has been developed by one of our psychiatrists, and he uses a particular tool to improve self-compassion and all the competencies of emotional intelligence, and that is called as loving kindness meditation. So how do you teach emotional intelligence? I mentioned earlier in AdCom module, we follow a hybrid problem-solving approach, which actually targets the IQ rather than the EQ. Do we take lectures to teach emotional intelligence? Do we conduct workshops or seminars? I don't think these are the best ways to teach them. What we could do is establish communication skills lab, which are dedicated to imparting emotional intelligence skills. Now, there are some inventories, one developed by Ruven Baron, who developed a self-reporting test of emotional intelligence in order to assess a person's EQ inventory as a starting point to develop an individual's potential. This one has been developed by Stephen Steen and Howard Book, who have developed one called as EQI 2.0 assessment. How do these questionnaires or inventories help you to develop emotional intelligence? So what happens during this process is the emotional intelligence of individuals is scored. The development areas are identified and the relevant blind spots are targeted, whether it is personal competence or social competence. And once it is identified, remedial measures are employed for them. And what are these remedial measures? Well, mindfulness. Mindfulness is a process by which an individual actively observes his or her thoughts and feelings without judgment. Mindfulness has a foundation in Eastern meditation. Mindfulness, though it developed in the East, it has been accepted as a method for stress reduction in the Western culture. And research indicates that it improves all 4 competencies of emotional intelligence. Here, I would like to play a short video by Dr. Muthu Ranan. He's a psychiatrist. He's a medical lead and in the adult community mental health services at Auckland in New Zealand. He's also art of living mindfulness practitioner. Let's hear him. I hope you can hear. I think it got stopped. 1 second, please.
Madam, the audio is not
audible,
clear,
ma'am.
madam.
Not clear, sir.
Yes, madam.
Yes.
Sorry. What I'll do is, I've already told Dr. Ilan Kadir, I was a little skeptical about the video play. So I will post it to Dr. Ilan Kadir and he can post it to the participants through the email. Basically, he's a mindfulness practitioner and he's actually going to conduct a session on practicing mindfulness. Moving on, let's see what is a roadmap. How do we follow a roadmap for fostering emotional intelligence in medical education? So the first step would be to find champions who would identify emotionally intelligent faculty and practitioners with good communication skills, self-management skills, and healthy relationships. The second step would be to build a strong knowledge base, to engage knowledgeable experts, to teach emotional intelligence concepts, competencies, and strategies to the participants. That's what I was trying to do today with Dr. Anand's video. And next is to create a vision for success. That is, how would you roll out a plan for introducing emotional intelligence into the course in your institution? And not just that, but how to sustain your initiative. We also need to ensure that there is a collaboration done by students, faculty, as well as administration. Everyone must be on board. And the institution must support development of emotional intelligence throughout the academic year and not just for short periods of time. Research tells us that to be effective in developing emotional competence, the approach needs to be, we need to connect the learner to the limbic system where the habits are developed. The training needs to be personalized and tailored to the individual, and it involves reinforcement and repetition over a period of time. The take-home message on my session on fostering emotional intelligence, a 21st century skill in medical education is, emotional intelligence is defined as a set of emotional and social skills that influence the way we perceive and express ourselves, develop and maintain social relationships, cope with challenges, and use emotional information in meaningful and effective ways. Emotional intelligence in medical education means it helps us to manage emotions and influence team-based care, supports empathy and improved communication with patients, promotes shared decision-making between medical professionals, and helps in conflict management. The emotional intelligence competencies as identified by Dr. Daniel Goleman are self-awareness, self-regulation, social awareness, and relationship management. Mindfulness is one of the tools which helps us to build on emotional intelligence. What is mindfulness? It is being in the present moment and be aware of where we are and what we are doing. Dr. Manju, the organizing chairperson, this morning mentioned that we, the basic science faculty, lay the foundation of medical education. So we need to champion the cause of fostering emotional intelligence in our students as well. We need to bring about the change that we wish to see in the world. I would like to conclude by quoting Warren Bennis, who has said that emotional intelligence, more than any other factor, more than IQ or expertise, accounts for 85% to 90% of success at work. IQ is a threshold competence. You need it, but it doesn't make you a star. Emotional intelligence makes you a star. Thank you. A threshold competence meaning it doesn't differentiate between superior and average performance, but emotional intelligence can. Thank you.
Thank you, ma'am.
Thank you, madam, for such a interesting and informative session. Actually, it gives us insight how we should look at it. We can implement it at the first year level. Now, new students have joined. So definitely, it has given us insight that self-directed learning and whatever we are giving them, that is also one way we are making them or training them for this emotional intelligence. So we will also like to, we will have a different attitude when we implement all the competency based education. We will definitely use this idea as mindfulness, how it will reduce the stress level in the students. So it was really, really helpful. And one thing which I liked is it will connect learner to limbic system. So all of us are learners and we will it will connect us to our limbic system. Thank you so much. Session is open for questions.
Thank you, ma'am.
So, am I being seen? Good morning,
Yes,
madam.
doctor.
Yes, sir.
Yeah, that was a wonderful presentation. I feel there is a need of the hour because, as you rightly mentioned in the beginning, doctor fatigue and all those things happening in the today's world, including the pandemic and the pressure. I think that is a need of the hour. And we all know that the very fabric of our fraternity is empathy, right? Everything, there is sympathy in action. So the medical fraternity grew and everything, all the discoveries and all the intelligent stuff which came up later, they're all based upon the need-based, basically, because of empathy. And the second thing is only what we human beings have got, which we do a lot, very few do a lot. That is a smile, which is the greatest gift I think our species has got. The best jewel which the nature has given, which outsmarts any diamond or any necklace. So these are the two things which I feel in the beginning stage, since we don't have a specific aptitude test as in like in other universities, we don't have the aptitude test. So just rightly the IMA, the Indian Medical Graduate, IMG, one of these criteria being the communication skill. As you rightly mentioned, the early clinical exposure will definitely help to keep a kickstart or to keep things rolling. Now, when it comes to this assessment of the EQ, or there is a scale for assessment. So can we really incorporate this objective assessment into our current curriculum? If we can do something about it, can you throw some light on that?
Thank you, Dr. Arun. You rightly pointed out about the smile that connects individuals with each other. So it improves relationship management. There may be, just terminology that we use. I'm sure all of us agree that the smile connects us all. Coming to your question.
Only in the evenings when we're closing.
Can we mute the person who is speaking? Okay. Your question was about objectively assessing emotional intelligence. IQ has a lot of questionnaires. We also know about personality assessment by Myers-Briggs. That's been very popular. There are a lot of inventories, like I pointed out. There's been a study done in Chennai for postgraduates on assessment of their emotional intelligence. They have used a validated questionnaire, which was initially developed by Salem and John Mayer. They are the pioneers of developing assessment questionnaires or inventories. And these people have modified it and validated it. And it has proved, successful. But we must understand that emotional intelligence is a new concept. It's come out very recently. So there's not much research work having been done so far. And we have begun to introduce emotional intelligence in our students, but the outcome can be measured after they pass out of the MBBS course. And like you pointed out, once they become an Indian medical graduate, I think that's the right place for us to gauge whether they have gained emotional intelligence.
Thank you. Thank you so much.
Thank you, Dr. Arun.
Thank you, ma'am. That's all we have. We don't have any queries in the chat box. That was a wonderful presentation, madam. Thank you, ma'am.
Thank you, sir.
It's time to honor our speaker today. We thank the chairperson. It's time to honor our chairperson, Dr. S. Sundrapandian, sir. Dr. Manisha, madam. Thank you, ma'am.
Thank you, sir. Thank you,
ma'am.
Manisha, ma'am, and Dr. Sundar Pandian, sir.
Thank you, ma'am. Thank you for that illustrative presentation. So regarding self-awareness and social awareness, self-management and relationship. Of course, nowadays, what I am observing on the clinical side, there is no much interaction between the patient and the doctors, recent generation doctors. Interaction itself is not there. First, we have to motivate that. Then only we can assess all these things. So it is definitely need of the heart. But before introducing to the students, it should be taught for the teachers also.
Definitely, sir. Faculty development is the first
Yes.
step.
Yes, ma'am. Yes, ma'am. That is more important. Nowadays, that recent generation teachers also, they are like that. They don't have much interaction with the students. Another thing, throughout the course, we have to implement that. So now if you take yoga and all, for 20 hours or 30 hours like that we are doing, but we are not following it. So that is more important. Throughout the course, it should be there. So we have to monitor it, ma'am. That is more important. Yoga
So you're
should be there
absolutely
after
right. So
Yes,
you're
yes,
absolutely right. We have started that value-added program called as values-based life skills and self-compassion. It's a longitudinal program. It's by a
yes.
psychiatrist who has begun in the first MBBS, and he is going to follow it up longitudinally till they finish final MBBS. You're absolutely right, sir.
Yes, ma'am. Thank you, ma'am. Thank you.
Thank you,
Nice to
sir.
see you.
Thank you, sir. Nice meeting you, sir.
Thank you.
Thank you, sir. Thank you.
Thank you, sir.
Irangadir, sir. Thank you.
Thank you,
for
sir.
the opportunity.
Thank you, sir. Thank you. Thank you, sir. Thank you, ma'am.